Good evening, lovely people. Welcome to the Ghanaian Doctor. This is Dr. Chimisi. Today I'm going to discuss cervical cancer with you. Cervical cancer is quite common. In Ghana, it's the second leading cause of cancer in our women, following breast cancer. The problem with cervical cancer is that in the first few years, when it comes, it's not able to be picked by anything except by investigation. You don't have any symptoms, you're just fine until several years later when it's gone to its advanced stages before it will show any symptoms. Because of this, there are a lot of investigations available to identify cervical cancer before it becomes a problem. We'll talk more about this very soon. How does cervical cancer present? Apart from not coming with any symptoms, the first signs of cervical cancer is having pain during sexual intercourse. Apart from pain during sexual intercourse, you can also come with bleeding during sexual intercourse. You can come with bleeding in your urine, bleeding in your stools, or even painful urination. There are lots of other medical conditions that can present similar to cervical cancer, like pelvic inflammatory disease or PID, vaginitis or inflammation of the vaginal area, or even cervicitis. But what differentiates cervical cancer from these ones is that cervical cancer causes long-term or long-standing problems which can spread to other areas of your body and that can actually kill you directly. So even though they can present in a similar way, cervical cancer is way more dangerous and should always be considered when you have any of these other symptoms. How does it happen? Usually there are two organisms of a group called the human papilloma virus. Now these two organisms are the strains 16 and the strain 18. These two, together with the strain 45, cause over 95% of all cervical cancer cases. In addition to these two strains, there are others, which is the 6 and 11 strains, which can also cause genital warts in individuals. But the strains 16 and 18 are more linked to cancer. The things that can put us at risk of having cervical cancer include having sex very early, the age of first intercourse. If you have sex very early at a very young age, that's the first risk factor. If you have multiple sexual partners, if your sexual partners are also promiscuous and they're also having multiple sexual partners, these are the major risk factors. And then finally, if you have an immunosuppressive illness like HIV/AIDS. So, in case you get cervical cancer, what do we do? The first thing we can do is that we have to stage it and determine exactly how bad it is. If it is early or it's in the early stages, we can do surgery, use laser or liquid nitrogen to freeze off the cancer cells and literally cut it out. If it's a bit advanced, we can use radiation therapy or medications called chemotherapy with or without surgery to take care of you. So that's usually the mode we use to treat cervical cancer. If cervical cancer is identified early, the stage 0 to stage 1, in over 90% of people, they survive after 5 years. But if it's identified late, when it's gotten to the stage 4, where that's spread beyond the cervix to the pelvis area, to the heart, to the lungs, to the bones, if it's gone all the way to these places, most of the time survival is less than 3 out of 10 people. So the most important thing in cervical cancer management is to identify it early and provide appropriate management for it. So how do we prevent cervical cancer? Stick to one partner, and your partner should also stick to one partner. Most cases are linked to sex. There are actually very few cases of cervical cancer that have been found in virgins. It is very rare, it's quite rare. So if you stick to one partner and your partner also sticks to you, one partner, the risk of having cervical cancer is way lower. And also if you have the means, you can also get some vaccination to prevent it. The issue with vaccination is that because there are so many strains of cervical cancer, it's not fully protective and no vaccine is 100% protective. And even with the ones that covers a lot of cervical cancer organisms, meaning HPV strains, usually it's not able to maintain its immunity for a long time. The maximum ones I've seen is up to 6 or 8 years. So even if you're getting vaccinated, you should always try and make sure that you keep that sexual hygiene about yourself. You stick to one partner and you stay away from multiple partners. I hope you've learned something about cervical cancer. This is quite brief, but I hope it was informative. Hit me up in the comments if there's anything you expect that I didn't hear so that we can address that very soon. In my next video, I'll talk about genital warts. I hope you learn about something in there too. Thank you and take care.